In the last 2 years, the NIHR Biomedical Research Centre, in collaboration with its partners at Imperial College and University College London, and with the Francis Crick Institute, have rolled out an exciting one-year fellowship programme targeting clinical trainees who are committed to a career in academic medicine. The goal is to exploit the cutting-edge science at the Crick Institute with the extended portfolio of translational research opportunities at the biomedical research centres. Joining me today is Dr. Robin Dart, gastroenterology trainee and one of our first BRC Crick Fellows. Robin, how far had you got in your gastroenterology training before you started thinking about this research project?
I was about halfway through my gastroenterology training. I'd initially done my SHO training here at Guy's and St Thomas's and then moved to North East London to do that. And I was well along with my procedural skills, and I was really looking for an option to do some research training. And so the Francis Crick Institute fellowships were a really good way of me getting into the lab full time to do some basic science research.
Now, your project is around innate immunity and inflammation. So how did that link with the sorts of conditions that you had been dealing with as a clinical trainee?
So I became interested in the inflammatory bowel diseases quite early when I was at medical school, and I found that I was interested in host immune interactions. And so I wanted to do something in innate immunology because it's central to inflammatory bowel disease and the inflammatory bowel disease pathogenesis.
So how did you find out about the Crick Fellowships?
So I'd been looking for some research opportunities, and I had previously worked with one of the consultants at Guy's and St Thomas's, Peter Irving, and he introduced me to Professor Hayday, who has an interest in this area, and who then put together a Francis Crick Institute fellowship, which I then applied for.
So that year that you had getting data and preparing for external funding, tell me a little bit about that and the advantages of that extra year.
So this has been a really brilliant opportunity for me to get into the lab. I've really enjoyed actually being able to do the research, which I've been planning on doing for quite some time. Being able to be in the lab has just given me the opportunity to actually understand what I'm doing and develop my research question further. And I think it's really, really important. I think I would have really struggled to get further funding to complete this as a PhD had I not had that experience which I'm having at the moment.
And did the research plan overall change once you joined the lab?
I think it did. So we started off with a focus on one aspect of this immune surveillance, or innate immunity if you like, and I've really broadened that out and changed my focus of that to make it more relevant to the inflammatory bowel disease question.
And then you applied to the Wellcome Trust for funding. How did that go?
So it was a lot of work to put the grant application together, and I was very lucky that I wasn't in full clinical training trying to do it in the evenings and after clinic. So I put that together, and then I went to interview to defend the project, and I think I was very well equipped to defend the project because I'd spent so much time in the laboratory. I was also well prepared, having had several mock interviews, including with the BRC, and that made it a much less stressful day than it may otherwise have been.
So a bit more about the project. What sort of laboratory skills have you acquired in the last year or so?
So the majority of what I've done recently has been tissue culture and flow cytometry and some activation assays. So I'm looking at ex vivo cells. I'm also learning some molecular skills in transfecting cell lines and PCR. I'm in a really big multidisciplinary lab, so it's been really good because I've been able to learn different techniques from different people, and that's really what I wanted from my PhD.
And finally, how do you think that having the link with the Crick will help support your research?
So the Crick is a really exciting opportunity, and it's great to be one of the first clinicians in there. So what I've mainly been doing is some immunohistochemistry at the Crick Institute, which is at Lincoln's Inn Fields currently and will move to King's Cross. And then the bioinformatics is going to be extremely important, and we're going to use their sequencing facility to further understand these cells in much greater detail than we would otherwise have been able to.
Well, Robin, congratulations on your Wellcome Fellowship, and thank you for telling us about your project and the fellowship you've been working on.
Thank you very much.
So Robin's experience highlights the value of taking time out of a busy clinical schedule and spending time in the laboratory preparing for a highly competitive research fellowship program.